Okay, good morning, Prof. Osman. Good morning, Miss Philia and Ms. Mutiara, and also good morning, friends. Today, me and my friends are gonna present a topic called lactose intolerance. So, my name is Andi Alelda, and my friends are Aulia Oktaviani and Hanifah Khansa. All right, so the outline for today's presentations are number one, definition, number two, hydrolysis of lactose and lactose deficiency, number three, types of lactose intolerance, number four, what if there is no lactase in our body, number five, treatments. So first of all, I'm going to talk about the definition. So what is lactose intolerance? Lactose intolerance is the inability to break down a type of natural sugar called lactose. Lactose is commonly found in dairy products such as milk and yogurt. A person becomes lactose intolerant when their small intestine stops making enough of enzyme lactase to digest and break down the lactose. When this happens, the undigested lactose will move into the large intestine. The bacteria that are normally present in your large intestine interact with the undigested lactose and cause symptoms such as bloating, gas, and diarrhea. The condition may also be called lactase deficiency. Okay, moving on, I'm going to talk about the diagram on the left side. The diagram on the left side is a diagram that related to lactose digestion, to lactose gene expression, lactose enzyme activity, and lactose intolerance. The two main outcomes are lactose intolerance and lactose intolerance. LP refers to lactase persistent, which is usually associated with one of five known alleles. LNP refers to the lactase non-persistent phenotype. LD is lactase deficiency, which means not producing sufficient lactase to hydrolyze lactose or having a condition that prevents lactose from coming into contact with lactase. LM is lactose maldigestion. And the arrows indicate the strength and direction of the association. The table on the right side here is the detailed definition of the terms that I've mentioned before. Now I will explain the diagram from the right arrow or the red side, the red one here. So if the adult is LNP or lactase non-persistent, it means that they doesn't carry any variant that causing persistent lactase expression into adulthood. Next, if they are LNP, then they are lactose deficiency or LD, which is a recessive which is a reduction of intestinal lactase enzyme from any cause, either genetic or LNP, or any secondary causes like disease or injury of the proximal small bowel mucosa. And if it's LD, it means they are lactose maldigestion. That means lactose is not hydrolyzed and transit to the colon. And if they are LM, it means they are lactose intolerance and they will adverse symptoms after consuming lactose, such as gas, bloating, and diarrhea that I've mentioned earlier. And now moving on to the left arrow, which is the green side here. So if that person is lactose persistent or LP, which means a dominant genetic trait usually associated with continued high level of lactase production into adulthood, they have two different conditions. The first one, if they could be still producing lactase here, or they couldn't produce lactase or lactose deficiency, that will lead into the conclusion that they are lactose intolerant. However, if they still could be producing lactase, it means the lactase could hydrolyze lactose in the small intestine, and it means that they are lactose tolerant, and there is no adverse symptoms after consuming lactose. Next will be presented by my friend.
Now, we are going to talk about hydrolysis of lactose and lactose deficiency. Lactose intolerance is a disease characterized by the inability to digest and absorb lactose due to the low activity or low production of the beta-D-galactosidase enzyme, popularly known as lactose. As already shown in the picture, unhealthy condition lactase hydrolysis lactose, releasing the galactose and glucose monosaccharides for bloodstream absorption. These monosaccharides pass through the portal system and are transported to the liver, where the galactose will be converted to glucose. This enzyme is present on the apical surface of enterocytes with higher productions in the jejunum. Next. People with lactose intolerance do not produce enough lactase, so lactose stays in the digestive system where it's fermented by the bacteria. This leads to the production of various gases which cause the symptoms associated with lactose intolerance. If there is not enough lactase, the unabsorbed lactose moves through your digestive system to your colon or large intestine. Then the bacteria in the colon break down the lactose, producing fatty acids and gases like carbon dioxide, hydrogen, and methane. Next. Types of lactose deficiency. Next. As what I explained before, people with lactose intolerance do not produce enough lactase may also be called lactase deficiency. There are some types of lactase deficiency. The first type is primary lactase deficiency. Primary lactase deficiency is the most common cause of lactose intolerance worldwide. This type of lactase deficiency is caused by an inherited genetic fault that runs in families. Primary lactase deficiency develops when your lactase production decreases and your diet becomes less reliant on milk and dairy products. This is usually after the age of 2 when breastfeeding or bottle feeding has stopped, although the symptoms may not be noticeable until adulthood. The second type is secondary lactase deficiency. Secondary lactase deficiency is a shortage of lactase caused by a problem in your small intestine. It can occur at any age and may be the result of another condition, surgery to your small intestine, or taking certain medication. Possible causes of secondary lactase deficiency include gastroenteritis, long courses of antibiotics, chemotherapy, etc. The decrease in the production of lactase in secondary lactase deficiency is sometimes only temporary, but it may be permanent if it's caused by a long-term condition. The third type is congenital lactase deficiency. Congenital lactase deficiency is a rare condition that runs in families and is found in newborn babies. It's caused by an inherited genetic fault that means affected babies produce very little or no lactase. This means both parents must have a copy of the fault gene to pass on the condition. The last type, some babies born prematurely before the 37th week of pregnancy have a temporary lactose intolerance because their small intestine was not fully developed by the time they were born. This is known as developmental lactase deficiency and usually improve as affected babies get older. Next, we'll be continuing with my friends.
Next is, what if there's no lactase enzyme in our body? Next. Lactose belongs to the group of disaccharide. Therefore, our body needs lactase enzyme in charge of decomposing lactose sugar into simple sugar, namely glucose and galactose. Without lactase, lactose remains in the gastrointestinal tract and cannot be used by the body and causes certain metabolic disorder. A large amount of lactose in the small intestine will give rise to an osmotic load, which leads to discomfort and later to diarrhea. If the colon is incapable of compensating that load, osmotic diarrhea occurs when components of the food that you eat remain in the intestine because they cannot be absorbed properly. Osmotic diarrhea can cause loss of fluids and electrolytes such as sodium, potassium, and chlorides. In such circumstance, the person must be obtain nutrients to fulfill his needs. For your information too, there's a lactose-free milk that contains zinc and nucleotides to support the faster regeneration of intestinal villi cells so that lactase can be reproduced. Next. Next is treatments for lactose intolerant sufferers. The first one is limit the dairy product. The avoidance of all dairy product in patients with lactose intolerance is no longer recommended. People with lactose intolerance should be encouraged to restrict rather than avoid lactose. For example, is the consumption of low lactose milk. This aims to keep lactose intolerant sufferers get calcium and vitamin D from the food or drink that they consume, and it also might be possible to increase their tolerance to dairy product by gradually introducing them into their food consuming. The second one is non-dairy substitute. If your tolerance of lactose is getting worse, consumption of non-dairy substitutes has been on the rise. These products are primarily derived from plants such as soy, rice, hemp, oat, coconut, almond, and other nuts. They can be fortified with one or more of the following: calcium, vitamin D, A, B12, and riboflavin. The food industry can also do its part by improving product labels, indicate lactose content, and avoiding misleading claims. And the last one is exogenous oral enzyme. Lactase produced largely from lungs, from fungi or yeast, can be used prior to or added to dairy meals to aid in digestion of lactose. Enzyme come as gel, like liquid, capsule, or tablet. They containing the lactase enzyme and might help you digest dairy product. You can consume it just before a meal or snack, or can be added in milk. Next. This is some product of help your lactose intolerance. The first picture is a free lactose milk product that you can consume. The second is advice for your food consuming to substitute dairy product. Sample is butter to olive oil, and the other one. And the last one is lactose capsule that you can add it onto your milk. Next. This is reference for our presentation. Maybe that's enough for our presentation. We were sorry if there's mistake. Thank you for your attention.